So, firstly, could you kindly introduce yourself?
I am Dr. Wajih Shinwari, surgeon, and I'm Associate Professor in Frontier Medical College, Ahmedabad.
Okay, as an ENT specialist, what is your primary role in the life of a deaf child beyond the initial diagnosis?
Basically, the first thing important in a deaf child is their diagnosis because the diagnosis is important. If it is not diagnosed before 5 years, after 5 years, the speech center will develop in the brain that doesn't develop. So if it doesn't develop, he won't be able to speak for the whole life. He becomes a handicap. So diagnosis is very much important. After the diagnosis, we go for the rehabilitation of the patient. We see that it is mild hearing loss, moderate, or severe hearing loss. If it is mild to moderate, we use hearing aids. Hearing aids is very good for the rehabilitation of the patient. And if it is moderate to severe, then we give a trial of hearing aids. And if it doesn't work, then we go for the cochlear implants. And the cochlear implants are important, and we refer the patient to such a center who are reliable in putting cochlear implants because it's a huge operation. You are installing a computer inside the brain of the patient. So that is very much important that he reaches a very well reputed and competent surgeon. That's the role of a ENT surgeon in deaf
Okay,
child.
okay. From your experience, what are the biggest non-medical barriers that prevent deaf children in Pakistan from getting a quality education?
Non-medical barriers. First is these norms and these the cultures that are the barriers because most of our population is in such an environment that makes a hurdle like no for education for the female children and sometimes in the educated people very early education of the child mostly like putting their children in 2 or 3 years of life in a school. That is a very big damage to the brain. This is not the age to discipline a brain. This is the age to facilitate it to grow. The best time to make it educated is after 5 to 6 years. After 5 to 6 years, the brain is ready for taking the knowledge. But if you put him or her in 2 years or 3 years, because most of our parents they are in such a hurry, like they want to make their children scholars and they put them in 2 or 3 years. What this damages their learning capability, and they develop a fear from the book. So it's not a good time to educate the children 2 or 3 years. The best time is after 6 years. These are the non-medical
Okay,
barriers.
okay. So, in terms of assistive technology such as cochlear implants or high-end hearing aids, how does the
Yeah.
cost and accessibility of these devices
Yeah.
impact a child's educational paths, especially for low-income families?
Yes, this is a very good question. In Pakistan, there is a monopoly at the surgeon's end also. The cochlear implant is such a device which cost 2 to 2.5 million rupees. Now, the only the good competent doctors they can do it, and they don't train other doctors for such a technology because they don't want that it gets out of their hands. They want to establish their monopoly. And the second is, the high cost of this cochlear implant. As I told you earlier, it's 2 million to 2.5 million. So a normal person, even a lower middle class or middle class, average middle class, he cannot afford such an implant. In India, which is just similar to us, 90% of the doctors are well versed with these techniques of putting cochlear implants. But in Pakistan, in Islamabad, we have only 1 or 2 doctors who can put cochlear implants. Now look at this situation. In Lahore, there are also only 1 or 2 doctors. In Peshawar, the whole Peshawar and KBK, there is only 1 doctor who can put cochlear implant. And in Karachi, there are 3, 4 doctors who can put cochlear implants. So what can you expect from such situation? 25 to 50 million population, and you have not more than 10 cochlear implant surgeons. So this is a very bad. It's not bad. It's worse situation, and it's both on the doctors end and the technology end. The technology is very costly, and and the doctors have also produced monopoly. They don't teach it to their younger surgeons.
Okay, so further on, what is one key policy change or action you believe the Pakistani government or healthcare system should prioritize to improve educational outcomes for deaf children?
Yeah, this is a very good question. My friend, he's in UK. He told me that he took his son to the hospital, and they did his, evaluation, hearing evaluation. In Pakistan, there is no such thing as hearing evaluation. Whenever a child is born, the first thing that like you are doing polio vaccine programs and all this, there should be a program of BERA. BERA is brain evoked response audiometries. Every child who is below 2 years should have BERA test so that we can establish a diagnosis for him. First is the diagnosis. If it is not diagnosed, how can he can be treated? So in every hospital, in every like districts, and there should be BERA programs, brain cell work response evaluation. What is BERA? BERA is just like ECG. The ECG is of the heart. BERA is of the brain. You put electrodes on the head, and then in a sleeping child you give some sounds, and if the brain is evoked, it is doing response. It means that the voice is going through the ear to the brain. So BERA should be introduced in every childbirth, but it's unfortunately not here. In England and in progressive countries, they have these BERA programs. But unfortunately, we don't have this one, and it's not so costly investigation. It mostly costs 2 to 3 thousand rupees, which is nothing.
Okay, thank you so much for your time and the incredible detail you've provided. If you had one final piece of advice or a message you could give to the families of deaf children or to the educators in Pakistan, what would it be?
Okay, I'll tell you a simple trick to see your child is developing speech or not. Whenever the child is sleeping, take some, bowl or thing and put some spoon on it, make some noise, and see if it is the child is responding or not. Or the other thing is take a toy which makes a noise, and when the child is not looking at the back, play with the toy and see whether the child responds or not. If he's not responding, it means he's not listening. This is called play audiometry. So these are the simple tricks which the mothers and the fathers of the child can do. Call him by his name when he's 2 or 3 years, and at the back, from the back. If he responds by looking, it means that he is responding to the sounds. So if a child is not responding to the sound, you should have high suspicion of hearing loss. Take him to the nearest audiometry center and do these early age audiometry tests for themselves. Do this on your own. Don't look at the government. They don't have time for such beneficial things.
Thank you for your time and your input on this matter, and that concludes our interview. So thank you
Thank
for
you.
your time. Okay.
Thank you. You are
Allah,
welcome. You are
Thank you
welcome.
Allah
so
Hafiz,
much.
sir.